The symptoms of this virus, which is fever, cough, shortness of breath, can be signs of various ailments, ranging from the flu, throat infection to a common cold. But experts and researchers have obtained more information on how this viral infection develops, besides what remains to be studied further.
How does this virus infect people? The virus breathes through saliva droplets that come out of people's mouths as a result of coughing or sneezing, which then enter the bodies of those who are nearby through the mouth, nose, and eyes. The virus then enters the respiratory tract and mucous membrane at the back of the throat, attaches to a receptor in the cell, and begins to develop there.
This virus has a protein with a sharp tip that allows the virus to attach to the cell membrane, and from there, the viral genetic material enters the cells of the human body. The genetic material then hijacks the cell metabolism and makes the cells no longer develop for the health of the body, but to reproduce the virus.
How does this process cause breathing problems? As these viruses develop, they start infecting the surrounding cells. Symptoms usually begin in the back of the throat, in the form of sore throat and dry cough. Then the virus quickly creeps into the basement of the lungs until it enters the lungs.
Swelling of the lung tissue and lack of oxygen in the blood causes the tissue to fill with fluid, pus, and dead cells. Pneumonia, inflammation of the lungs can appear. This can make the patient have difficulty breathing, so he needs a breathing device or a ventilator. In some cases, what is known as acute difficulty respiratory syndrome or acute respiratory distress syndrome, so that even with a ventilator, patient can die from breathing difficulties.